cut tool, I'm going to remove the skin from the posterior leg from above the popliteal fossa, which is mid-thigh, to the ankle. And then I will hide the subcutaneous tissue on the left screen. Next, I will identify the borders of the popliteal fossa from the superior angle. The medial border, which is the semitendinosus, and the semimembranosus. The semitendinosus muscle and the semimembranosus muscle on the medial aspect, and the biceps femoris on the lateral border. The inferior angle, I will identify the lateral border, which is the lateral head of the gastrocnemius, and the medial border, which is the medial head of the gastrocnemius. The lateral head of the gastrocnemius and the medial head of the gastrocnemius. Next, I'm going to identify the popliteal artery and vein. This is the popliteal vein and the popliteal artery. Next, I'm going to use the cut tool to remove the biceps femoris muscle and identify the sciatic nerve, where it splits into the tibial nerve and the common fibular nerve. This is the sciatic nerve, and this is where it breaks into the common fibular nerve and the tibial nerve. Here's a closer angle of the sciatic nerve and the fibular nerve and the tibial nerve where it branches off here.
Move to the superficial posterior compartment of the lower leg. Identify the saphenous, small and great vein, and the saphenous and sural. This is the great saphenous vein. This is the small saphenous vein. Next, using the cutting tool to remove the
gastrocnemius
by making two incisions, one on each head of the
gastrocnemius
to reveal the soleus muscle. Move the posterior compartment by identifying the plantaris muscle, noticing how the tendon looks very similar to the nerve. This is the plantaris muscle. Cut the soleus near its proximal attachment. Notice the intermuscular septum, which separates the compartments. On the left side of the screen, hide the septum. This is the intermuscular septum of the leg that we will hide.
Now we will identify the superficial fibular nerve. And as you can see, highlighted in pink is the superficial fibular nerve. Identify the fibular head, then find the muscle bellies on the perennial muscles, the fibularis longus and brevis. So here we have the superior extensor retinaculum, and we're going to hide this. And then below it is the inferior extensor retinaculum. Now we'll move on to the anterior compartment and identify the tibialis anterior muscle. And as you can see here, we have the tibialis anterior muscle.
About mid-muscle belly, we're going to use the cutting tool to make an incision on the anterior tibialis muscle, and we're going to remove the distal portion. Then we'll identify the extensor hallucis longus and extensor digitorum longus muscles. As you can see here, this is the extensor hallucis longus, and then this one highlighted is the extensor digitorum longus. Now we're going to move to the distal anterior ankle to identify the extensor retinaculum or reticulum. Now we're moving to the distal anterior ankle, where from medial to lateral, we'll identify the proximal part of the tibialis anterior muscle. Then we'll move on to the anterior tibial artery, extensor hallucis longus muscle, anterior tibial artery, extensor digitorum longus, and fibularis tertius. Now we're going to identify and cut the peroneus or the fibular brevis and longus tendons and the sheath of the fibularis muscles so that we can expose the lateral talocrural joint. Then we'll identify the anterior talofibular, calcaneofibular, posterior talofibular ligaments. To access the calcaneofibular ligament, you must first hide or remove the fibular retinaculum. This is the lateral talocrural joint. Then we're going to identify the anterior talofibular ligament. Next, we are doing the calcaneofibular ligament. This is the calcaneofibular ligament. Next, we're going to do the posterior talofibular ligament. The posterior talofibular ligament.
Superiorly and identify the anterior
tibular fibular ligament.
Okay.
This is the anterior tibiofibular ligament. Okay. Move superior and use the cutting tool to remove the muscles of the anterior compartment to reveal the
Interosseous.
interosseous membrane at the distal tibia and fibula. This is the interosseous membrane,
We'll remove.
which we are now going to remove. Now we're going to identify the talus. This is the talus. Now you're going to use the cutting tool to remove the skin from the plantar foot and identify the plantar fascia.
Mm-hmm.
The fan from the medial to lateral are the abductor hallucis muscle, the flexor digitorum brevis muscle, abductor digiti minimi muscle. Medial foot identify the plantar calcaneus navicular ligament, aka the spring ligament.